I have first initial dated and labeled the gauge of my needle. Prior to this skill, I verified the order, gathered my supplies, explained the procedure to my patient, verified my patient's name and date of birth, washed my hands, and put on gloves. First, I apply a tourniquet 4 inches above my vein. I then palpate for a vein. If it's hairy, I should clip around the area. If it's not, I find my vein. I release my tourniquet. After I release my tourniquet, I'm going to get my chlorhexidine. I'm going to rub and clean the area for 30 seconds. Dispose. After I've cleansed the area, I'm going to reapply my tourniquet. I'm also going to let the area dry for 30 seconds. After I reapply my tourniquet and the area is dry, I'm going to use my non-dominant hand to stabilize the vein. So I have my needle. I'm going to uncap my needle. I'm going to have the bevel facing up. I'm going to stabilize the vein. I'm going to enter the skin at a 10 to 15 degree angle and the bevel up. I'm holding the catheter by the hub on my dominant hand. Once I've inserted the needle, I want to advance it about another 1/8 of an inch to ensure that it won't enter. Once I've noticed my flash, my blood return in my first flash, I can advance slightly and lower parallel to the skin. I then use the push-off plate to separate the catheter from the needle and into the vein. Once I've done that, I can release my tourniquet. Once I release my tourniquet, I'm going to occlude the vein 1 inch distal, so I'm going to hold the top of the catheter and occlude it with my middle finger more than 1 inch away from the catheter. Once I do this, I'm going to withdraw the needle and expose in a sharp container. While holding this, I'm going to attach my plug. I'm going to undo this, and I'm going to attach and twist. I'm then going to pull back and assess for blood return. Once I get blood return, I can flush gently with saline, and there's no infiltration or leaking. After I flush, I'm gonna apply my dressing. I want to ensure the end is covered and the whole catheter is covered. And then I'm gonna remove the syringe and I'm gonna take off and make sure the date is in it. And then I'm gonna get a piece of tape. Make sure my catheter is stabilized. And place tape after making a J loop. To make sure everything is in place. After this, I'm going to make sure everything is in the sharps and dispose of all of my equipment. For removal of an IV, we're going to want to start with taking the tape off. Before anything, I verified the order. I gathered my supplies, which is a sterile gauze and a prep pad and some tape. I explained the procedure with my patient. I verified their name and date of birth. I washed my hands and I put on new clean gloves. To start, I'm going to stabilize the catheter. And remove the tape. And then to get the adhesive dressing off, I'm going to stabilize the catheter and pull carefully. And if it is not coming off, I'm going to use this to ensure the patient's skin is not irritated. I'm going to gently pull. using the prep pad while also keeping the catheter in place. Obviously, I would not pull on the patient's skin. Once I ensured everything is up, I'm gonna unpack my sterile. It's still sterile. And I'm gonna pinch, making sure the bottom is still sterile while it's touching the patient's skin. I'm gonna hover over my site, and as I quickly pull out to remove it, I'm gonna push down for 2 minutes. I'm going to hold down for 2 minutes unless my patient is on blood thinners. And if they're on blood thinners, I'm going to hold down for 5 minutes. While I'm doing this, I'm ensuring my catheter is intact, which it is, to make sure nothing is left in the patient's skin. After this is held down for 2 minutes, I'm going to get my tape. Making sure it's bunched to where the sterile is still touching the patient's skin.